Thank you, Professor Gamal. Next speaker is Dr. Hassan Lotfy. He will talk about bioresorbable scaffold in tibial arteries.
Bismillah ar-Rahman ar-Rahim. Good morning, Mr. Chairman, my dear professors and friends. First of all, thank you very much for inviting me for this great event, and I take the chance to congratulate all the committee beyond this conference for the great success, and I hope this be repeated every year. Today our topic is a new one. All of us as a vascular surgeon know exactly the differences between infragenicular or tibial vessels compared to femoral or iliac vessels. They are smaller, they are stiffer, lacking or with deficient elastin and collagen fibers, making them more prone for re-occlusion after successful revascularization. For this peculiar criteria, there is a temptation for stenting of tibial vessel in case of when you fail to have an adequate dilatation or to prolong patency of the vessel. But unfortunately, all the stents, most of the stents result in stent stenosis and occlusions that could preclude further intervention. And here comes the idea of having a stent which is not permanent, don't leave foreign body beyond. A biodegradable stent. You have a stent that is left in the artery for a small period of time or a controlled period of time until remolding of the artery and healing of what have done by angioplasties, and the stent go away, leaving nothing behind. These bioresorbable, they are not named stent exactly. They are a scaffold or a skeleton for the artery. They are formed of polymers of organic material that could degrade into CO2 and H2O by Krebs cycle. It takes some time to disappear, and by introducing some metal as iron, zinc, magnesium, you can control the degree of biodegradability and the time for biodegradability. But the problem is they are not visible or barely visible on fluoroscopy. So you have two radio-opaque markers to see them. They don't give a strong support for the vessel, and they are somewhat loose. So this limits their application. And to overcome the problem of soft skeleton, you have to design it in a thicker form that will hinder the blood flow and result in blood thrombosis. So some metals is added to improve its quality and to try to overcome this problem. During degradation of these skeletons, lactic acid is released, and it thought it might cause some sort of arthritis and some inflammatory reaction for the blood vessel. For this skeleton to dissolve, it takes about 1 to 3 years to disappear completely, with an average of 1 year. So we have some advantages for them. They improve long-term outcome for the patient because you don't leave foreign body in the artery, so you don't have problem of intimal hyperplasia or any stent stenosis and occlusion. Also, the absence of foreign body in the artery may reduce thrombosis and stenosis in the vessel, and it will allow for further intervention if needed in the future. As we have said, the traditional stent is made of metal or metal alloy, while those scaffolds are made of polymers. The mechanism for stent, the regular stent, is to do permanent structural support of the artery. On the other hand, it is a temporary one. As we know, we have a lot of data about the regular stent, but still we are lacking this data and long follow-up period for those of scaffolds. And patient consideration, as regard patient considerations, you think about stenting of the tibial vessel in patient with complex disease or highly calcific or failure of technical success in dilating tibial vessel. And we thought that the future of biodegradable scaffold will be more for the younger patient who might need further angioplasty in the future. There are some challenges in degradation of the stent. Sometimes degradation is not complete, leaving something behind. Sometimes the resorption is variable with weakening of the scaffold during the process of degradation, and there is some risk of thrombosis, as we have said before, due to arthritis due to the byproduct of degradation. The hope in the future is to optimize resorption rate with the changing of alloy and added material and the change of the polymer. Also to maintain mechanical integrity of the stent or the skeleton until proper time for remolding of the vessel. And the beauty for this is they think or they dream of having a custom stent for every patient by 3D printing. You can order. It is a part of the artificial intelligence. For example, you can order your machine to give you a stent with proper size that you need and the proper length, proper shape, so to decrease the amount of materials that you need to stent in the vessel. But it is still a dream. Also, in the future, they are trying to introduce some drug-eluting material in the stent, although there is some stent or skeleton with biodegradable material, but it's going on. And the problem is to integrate some form of imaging for the stent to follow up the degradation of the stent, because as we have said in the early in the talk, it is not visible in fluoroscopy. We need more data about the outcome and the long-term follow-up for the patient, and we need comparative study between metallic stent and the biodegradable stent, and what is the impact for future revascularization for the patient. There are few clinical studies about biodegradable stent. Most of them are for short-term, they are for a few number of patients, short-term, and lacking comparative study between it and the regular stent. We think that regulatory approval and market expansion for the stent could facilitate for adoption of this new technology in vascular surgery, and the collaboration and the innovation between the academic industry and the practitioner and surgeon and interventionist will address the current this technology in the current treatment of vascular patient. So you have a new, we expect to have a new armamentarium for vascular surgeon, as both biodegradable stent and the traditional stent could be used for the patient depending on patient criteria, lesion criteria, and the clinical judgment of the patient, and the ongoing research and the study will reveal the success of it. Thank you very much, and you have a good day.